Good evening. This is my Uncle Ryan Bradbury. He works for Stryker Orthopedics. We are going to talk a little about his company and what they do.
Hi, Jackson.
So my first question is, what is your job at Stryker Orthopedics?
I manage a sales team at Stryker Orthopedics, and my sales team sells orthopedic implants.
I know you work in sales, but can you tell me what kind of parts your company sells to help people in relation to prosthetics and body parts to help people?
Yes. So usually the parts that we sell are to help people who have arthritis, and they no longer have cushion in between their bones, cartilage in between their bones. So we sell implants that resurface their bones to relieve the pain of arthritis.
Does your company make the body parts?
We don't actually make body parts, but we make mechanical parts that go in place of the body parts to help people feel better and be able to walk again without pain.
What do the engineers look for when designing the parts?
So the engineers usually will study things like bone morphology, which means how the bones are shaped. And they need to make implants that fit the bones the best. So the God-given anatomy is mimicked, or they kind of copy that or emulate what the natural bone shape is, so it fits well, so the patients feel better because it's a well-fitting implant. So they take measurements, and they use CT scan, which is kind of like X-ray, but it's a different way to get a bone image, and then they design the implant around those images. Does that make sense?
Mm-hmm.
Good.
And do people grow out of the parts?
The parts that we sell mostly are for adults, so people who already have reached their peak maturity for bone growth. So they do not grow out of their implants. If they wear their implants long enough, for instance, 30 or 40 years, if they maybe got an implant in their 40s and now they're 80, sometimes the implants wear out, or sometimes if they fall and create a fracture around the implant, they have to replace the implants, but not because they grow out of them, because they either wear out sometimes, or they fail because of a traumatic injury like a fall.
And
right?
How much do the parts cost?
So that's a broad question with a broad answer. So it depends on the contract at the hospitals. So sometimes they're $3,000 or $4,000. They can be upwards to $20,000 or $30,000 per implant, or per procedure. But a lot of procedures will require 4 to 6 implants. So a big range, and it depends on the procedure, and it depends on the contract of the hospital, determines the price of the implant.
Okay. Thank you for your time today. I look forward to hearing more.
You're welcome. Thanks for your time, Jackson. Good luck on your project.
Thank you.
You're welcome. See you later.